This is Dr. Koushik Shah. In this video, we are describing the transurethral resection of the prostate, otherwise known as a TURP. As we go through the urethra, you can see that the lobes of the prostate are basically pushing in or collapsing down on the urethra. This makes it difficult for the patient to typically urinate. Here you can see the tissue, again compressing the urethra. We then enter the bladder, and you can see thickened muscle fibers here. The muscle fibers are thickened because the bladder has to generate additional and extra force in order to overcome the obstruction in the prostate in order to completely urinate. Again, as we come back into the prostate, you can see those two lobes of the prostate basically compressing the urethra. We then use the Gyrus device, which is using something called plasma kinetic activity to excise and remove the obstructing, blocking prostate tissue. As we remove the tissue, there are small blood vessels in the prostate, and you can see that we basically use coagulation to stop any bleeding that's noted along the process. We basically start at the bladder neck, which is the junction between the prostate and the bladder, and work our way down to something called the verumontanum, which is near the patient's urethral sphincter. We then go circumferentially from base to apex to remove all the obstructing tissue, and then carefully make sure that there is no residual bleeding, as we are doing right now. After the procedure is completed, a nice large open cavity is created, and the patient is able to urinate freely with a marked reduction in symptoms immediately after the procedure. Here are the prostate resection tissue, which is removed at the conclusion of the procedure.